Hello and welcome. Thank you all for coming along to the seventh in a series of disaster recovery conversations brought to you by the Victorian Council of Social Service. I'd like to begin today by acknowledging the traditional owners of the land from where I'm presenting, the Wurundjeri people of the Kulin Nation. I pay my respects to their elders past, present and emerging. And I extend that respect to all Aboriginal and Torres Strait Islanders people here today. I'd also like to acknowledge and thank the Lord Mayor's Charitable Foundation, which has generously provided the funding to allow this conversation to take place. Next, I'd like to introduce Kat Edmonds and Daniel Haitley, who you'll see on your screen, and they're our Auslan interpreters for today. Just a reminder that we're recording and will be transcribing today's conversation so that you can share it across your networks. If you've got a question for any of our speakers, please submit them in the Q&A tab on your screen. Today, we're here to talk about gender and disaster recovery. The role of gender in disasters was explored in depth by Dr. Deborah Parkinson and Claire Zara, who undertook groundbreaking research following the 2009 Victorian bushfires. This work has been built upon by Deborah and her colleagues at Gender and Disaster Pod, which has more recently changed its name to Gender and Disaster Australia. It's been slow going, but there have been huge gains made at the same time. To begin our conversation, I'd like to introduce Steve O'Malley and Rachael Mackay. Steve has been a firefighter for many years and is currently Diversity and Inclusion Officer, leading firefighter at Fire Rescue Victoria. Steve is also a board member of Women and Firefighting Australia, or WAFA, which is a non-profit professional organisation that supports women either in or considering a career in the Australasian firefighting industry. And Rachael is the Regional Change Coordinator at Women's Health Goulburn North East. Rachael is also a trainer with Gender and Disaster Australia and is due to launch a podcast soon about women in sport. Over to you, Jen and Steve.
Thanks for that, Bridget. That was a great introduction. Welcome, everybody, and thank you for having us today. I'd just like to acknowledge the traditional owners of the land on which we live and work and pay our respects to their elders past, present and emerging, and to any Aboriginal people joining today. I'm joining you from the land and waterways, which are quite big at the moment, of the Bangarang people. I think I'll just launch into the work that we're doing in terms of the Gender and Disaster Australia. Kieran, if you could just go to the next slide, that would be awesome. So that's our website there, and please go and have a look at it. We were previously, as Bridget mentioned, the Gender and Disaster Pod. Very recently, we've changed to Gender and Disaster Australia, and there's some fantastic resources on there which we'll go into a bit of depth about. But for now, thank you for the introduction, Bridget, and I'll hand over to Steve.
Thanks, Rach, and thanks, Bridget, for the introduction. I'm on Wurundjeri country, the land of the Kulin Nation, and pay my respects to elders past, present and emerging as well. And we do so at the start of all of our training sessions that Rach and I undertake and some of the other facilitators. It's an important part because colonisation has a part to play in a lot of the theme around gender and disaster as well. So if we could just go to the next slide, thanks, Kieran. And I'll get a bit of a whip around here of some of the activities of the GAD-Pod since its inception in 2015. So the Gender and Disaster Task Force was established in 2014, and it ran a life of around 3 years or so. And some of the outcomes of the task force, which was co-chaired by Susie Reid, the then CEO of Women's Health Goulburn North East, and Craig Lapsley, the then Emergency Management Commissioner. And it had some significant outcomes, not the least of which we'll show throughout the course of the presentation. The Gender and Emergency Management Guidelines, some postcards and resources that people can use. And proudly and personally, in the right-hand corner there, the blue section, one of the the most thrilling things for me over the course of my career, as I can say honestly, as I come to the end of my career in the fire services, has been able to establish an oration or a speech on behalf of, or to honour Claire and the work that Claire established with Deb back in that post Black Saturday. And the Claire's oration, if I do my math correctly, is into its 8th year this year. And this year, Dr. Nikki Vincent, the Commissioner for Gender Equality, will be delivering that oration this year in memory of Claire. And those former presentations can be found on our website as well. So this work is always underpinned by research and by statistics and by the hard work, the data that Claire and the anecdote that Claire and Deb so sensitively sort of extracted from the communities that were affected by Black Saturday. This was unashamedly a piece of work that was looking at the effects of women, disaster, more specifically the increase in family violence. As you would have had a look around the slide as it is here, that we've had some significant events, some significant conferences, significant research. And on the top right-hand corner there, the Diversity in Disaster Conference, Bridget was no less an important part of the steering committee for that conference, which was not so much innovative as more groundbreaking, because there hadn't been a disaster and gender and disaster conference of its like previously in the Southern Hemisphere, certainly. I'll throw back to you now, Rachel, if that's okay. Thanks, Kira.
Thanks, Steve. So if we could go to the next slide, Kieran, I just want to dive a bit deeper into the findings of the research report that Deb and Claire released in 2011. It was the first Australian research into family violence and disaster, or specifically intimate partner violence in the aftermath of the Black Saturday firestorm. And you can see the irony there in the way he tells it, because women's accounts of what was happening to them and what actually happened on the day were actually remained and became hidden. And what the research found was that for some women, the abuse was actually occurring in their intimate relationship before Black Saturday. And it actually became worse and was exacerbated after the firestorm. And for other women, importantly, it wasn't happening before and it began after the firestorm. So that was a significant finding. The researchers also found that there were huge issues around how the community and workers responded and excused violence generally in the community, but also within the home. At that time, Deb and Claire really started to find that there were commonalities with international research in that disaster context. So things like victim blaming, discourse around abuse in the home was very common internationally as well, and community attitudes that really excused men's violence as a natural or normal reaction to stress were another commonality that they found internationally. In the hierarchy of need, women's needs were really placed at the bottom. And the themes that emerged were particularly around language and the language that minimised violence. So people were saying things like, oh, he's just misbehaving, and really minimised women's experiences. The other issue that came out was the lack of data and data collection at the time. So at the time, I think there were only 8 women that were engaged with specific family violence services, and we knew that there were significantly more. So the big theme was obviously around community attitudes and worker attitudes that excused and minimised women's experiences of domestic and family violence. And at the time, I remember there was significant backlash, and many of you listening today might even remember that. The accounts of women were certainly not something that Claire and Deb wanted to find, and certainly community didn't really want to acknowledge that there were people in the community, men in particular, who were violent and were violent to their partners in their own homes. So what happened for the researchers when they actually gave the research participants their findings and their stories, a lot of women retracted their accounts because they were so scared of community backlash, of worker backlash, and of course of being identified by their partners. So since that time, we've really tried to operationalise the research, and Steve will talk to that a bit later. We know that, since that time, domestic and family violence has become a documented characteristic in the post-disaster recovery the world over. And I guess it's important to note that disasters don't exist in isolation. We all have social and cultural constructs that discriminate against women and place them at risk of violence. So the disaster context just exacerbates gender inequalities, basically. So I hope that gives you a good roundup of that particular research, and ask us any questions. I'll hand back over to Steve.
Thanks. To the next slide. Thanks, Kieran. That was that first piece of research in the conference that followed, the Hidden Disasters Conference, that was what sucked me in. I'd been involved in violence prevention, gendered violence prevention, or intimate partner violence prevention for quite some period before that, but the emergency management context really sucked me in because I saw the fact that we were existing in male-dominated workplaces, and that one of the main contributors or the determinants of violence against women is that strict gendered stereotype, the adherence that community has and the expectation that men should be stoic and they should adhere to that strict gendered stereotype, of which firefighting is within writ large. So I got it, and I've gotten it ever since, Rach, and we're still doing it. So we talk about it. What became apparent very quickly as Claire and Deb, and they pivoted way before anyone had to pivot during COVID. They swung their research around to deal with the effects of men as well. This is women's health service providers who are auspiced and operate through a feminist lens now had to look at the effects on men, because male suicide and self-harm and community violence was also a theme that was coming throughout the course of their qualitative chats and anecdotes that they were hearing. So we know, these are the things we know. These are the things that Deb and Claire found, that the impacts of disasters are severe and long-lasting. We know that the impacts from disasters, particularly in the themes that Deb and Claire are uncovering, weren't going to really be uncovered until years down the track. And the same goes for the personal impacts on families through family members who are suffering, severe mental health issues as well. Men generally don't. It sounds like a bit of a throwaway and sounds like a pretty obvious throwaway, but they generally don't ask, is what the adage would tell us. But Deb and Claire found that if you ask them, and if you ask them in a sensitive sort of way, that they would actually talk about their experiences. And we found that at the second iteration of the showcase, if you will, of the research, which was the Men on Black Saturday, the conference in 2013, which came after the original the Hidden Disasters Conference, where, believe it or not, the room was full of men at this time, because it was a little bit, we made it and a little bit about them. The research showed that men had just as much to gain and just as much to learn from delving into this research as well. I'll skip down to that second last point there about we know about the alcohol abuse and mental health and issues. We know about the contributors to violence. We know about the difference between the drivers of violence and contributing factors or triggers that may, enable someone to do violence. But what happens during disaster, and we unpack this a fair bit more during the training, but the gendered norms that the society is so ready to accept are more salient. They're more highlighted throughout the course of a disaster, where men are expected to actually sort the problem and save the people. Women are expected to nurture and escape. And those themes we unpack a fair bit more during the training. And that bottom point gets a bit of a run as well, which is the fact that it's more acceptable for men to be seen to be angry than emotional. I'll leave that there and move on to the next slide, and back to you, Rach.
Thanks, Steve. So this is an example of some of the resources that we developed. This is a postcard, and they've been widely taken up, particularly through local government and distributed. So the picture on the left is the front of the postcard, and you can see what's on the back of the postcard. And it really it's simple and it's effective. So there's 4 steps and who people can reach out to. The postcards are now available in 10 languages as well. So if you're interested, let us know and we can get them out to you. We've got a stock of them. So, yeah, I'll hand back to you, Steve.
Thanks, Rach. One of the other, next slide, thanks, Kieran. One of the other resources that we collaborated with community and sector-specific violence prevention and other services to actually come up with another product was, and another sort of project that was funded, and I can't remember who the funder was, but nevertheless, it was a postcard project in which we considered, or we asked community members to consider gender when they do their fire plan. So the gendered lens postcard encouraged couples to recognise the gender-based dangers, the fact that there is a feeling that last-minute decisions, generally by men, is a theme that runs through a disaster like a bushfire, say, for instance. Flood may be different, but if we're talking about a disaster like bushfire, like Black Saturday, where the certainly large campaigns preceding Black Saturday and including Black Summer just recently, that last minute decisions by a man just isn't necessarily a plan. So what we do is we have some points here that people can consider, and I'll use a scenario or give a descriptor of a family, and we're talking about, say in this instance, a heterosexual family who have children who are prepared to sit down at a table and write their fire plan. So actually writing, committing it to paper, writing the plan, agreeing on the points that they're going to follow when an event is looming. So well in advance, they look each other in the eye and they agree that this is the plan. It's not negotiable. So, you know, still, there's plenty of these out there and people enjoy to be able to talk to the cards, but whether or not they have an impact is yet to be seen, I suppose. Rach?
Awesome. So we wanted to also talk to you, next slide, thanks, Kieran. We wanted to talk to you about the development of the Gender and Emergency Management, or GEM, guidelines. We knew that there was an increasing understanding of how gender and disaster issues with that gender lens can improve the health and wellbeing of men and women affected by disaster across Australia. So it was 2016 and we were commissioned to develop the Gender and Emergency Management Guidelines. And it was completely Australia-wide. It was a collaborative approach where there were representatives from each state and territory. So the guidelines and the subsequent checklists actually include those contexts and experiences from across Australia. So we're really proud of them. The project really aimed to reduce those compounding effects of gender and impact through the development of those national guidelines, and sort of feel that there was a real gap in Australian knowledge in terms of how to apply the gender lens to policy and practice. So the guidelines have had significant uptake across Australia. The benefits of these have been really far-reaching in terms of the importance of looking at practices and policies with that gender lens. And they're actually being updated. I think they're pretty much done now in terms of including a pregnancy and breastfeeding lens, as well as looking at evacuation and relief settings. So, in fact, Steve and I have been working with the City of Casey, and we did a scenario mock-up of a relief centre, which was quite incredible, where we really looked at the guidelines and how they were actually implemented. So that was a pretty exciting thing to be involved in. Steve, did you want to add anything to that before we move into the checklist?
No, we'll go to the checklist now, if that's right, Kieran, and not to forget Whittlesea, Shire of Whittlesea, who were well and truly within the thick of things during Black Saturday, I should say. And that simulated or relief centre scenario was invaluable. If we can just move to the next slide, Kieran, please, Kieran. What the guidelines do, and we deal with this at the end of our training, the regardless of whether it's the 4-day or the 4-session training or the day long that Rach and I have delivered quite often, we get people to think about the where to from now, the actions. And when we walk away from the training, we're not just going to let it go in one ear and out the other. Anyone that's filling out their gender equality legislation knows the value and knows they'll be very well versed and practiced at looking at checklists, looking at an order, casting a gender lens over their policies and procedures. And that's what this kind of is too. It's looking at the guidelines and looking at a checklist within the guidelines to see exactly where the deficiencies are and maybe where the strengths are. And certainly in a case like Casey, like the City of Casey with Chrissy down there, that they're actually using that simulation as part of their reporting into the gender equality legislation pretty soon when it comes into play in December 1. So, I mean, and we've played a part in that, Rach.
Yeah, it was incredible to be involved in that. I also want to just highlight the domains, particularly around looking at program design and resourcing around your communications. So the checklist actually talks to looks at planning, it looks at workforce development and training, it looks at what your documents look like, facility design, etc. Yeah, they're fantastic. If everyone wants to get on and have a look, they're really helpful.
We'll move on to the next slide. Thanks, Kieran. And the thing that we talk about the guidelines and talk about the checklist quite often because they are a great output from the original task force and certainly the GAD pod. Our question now is why organisations aren't necessarily referring to them as much as they should. Certain organisations have. Red Cross in Queensland and the Inspector General of Emergency Management, say, for instance, are two to have. So I think we'll be moving to investigate why organisations aren't necessarily picking them up and encouraging them accordingly. So these are just a couple of the flyers about our training here. That's our lessons in disaster training. It is a double-sided flyer you can get online where Rach and I talk about those intimate partner violence overlays and the compounding effects of gender and disaster. And Liam Lennon is one of our valued associates, and Liam's work in the gay, lesbian health VIC space back in the day when he was our GL gay, lesbian health VIC. And now as a valued associate, as I said, delivers his He's under pressure, LGBTIQA plus communities in disaster as well. So an overlay and a really detailed look at the effects on, it's our initial steps into intersectionality, dare I say it. Back to you, Rach.
Next slide, thanks, Kieran. So the question is, how do we bring the gender schema into the 21st century? We need to look at, can we have the next slide? Thanks, Kieran. We need to look at disentangling masculinity from emergency preparation and response. So although the conversation around gender has changed over the past 10 years, recovery is still viewed as highly feminized work, as opposed to the manly mitigation and response work. We also need to look at frontline staff and volunteers are now being asked to have their gendered lens on their work, which I think Jenny will talk about a bit later. Despite the significant work in the space, levels of awareness around the increase in domestic violence during disaster is really still emerging. So we need to look at stop expecting men to protect the home and women to protect children in those very gendered roles. Let men be vulnerable. Ensure women and children's right to live free from violence is unconditional even after a disaster. So there are opportunities to identify and assess and respond to risk and safety, which can be integrated into responses to practical needs in the disaster. We know that One Metro Council has included family violence information in their fact sheets. So it's simple and yet an important upgrade. So again, whilst we're seeing some change in issues and attitudes in communities, we still see an increase in family and domestic violence, and we still see a reversion to traditional gender roles. We know that for many of the bushfire recovery teams in the communities, they're still hearing very similar stories covered in the research of the GAD pod 10 years ago. So what does the future look like for recovery? We need to continue to build awareness of the gendered nature of disasters in the workforce through training. We need to operationalise and embed these practices in our organisations. We need to consider gender and inclusion. We need to collect data and provide services and ensure equal access and women's participation in decision-making at all levels of preparedness, response and recovery. I think that's a really critical one. And this is a quote from the Gender Justice Conference: the importance of a gender lens to finding ways for women to rise with strength, insights and leadership. Lastly, recovery can allow women to be involved in some of the domains that are outside traditional gender roles. Let's look at that. Overcoming the challenges of recovery can be incredibly empowering to women working in that space. So that's it from me, and I'll just hand back to Steve for a wrap up.
Yeah, well, not so much a wrap as thank you very much to Bridget and VCOSS and everyone else that's going to present today. We relish the opportunities to actually speak about the work. Rach said it herself that that continuum that the emergency management sector operates, the PPRR, the prevention, preparedness, response and recovery, isn't that dissimilar to a health promotion continuum where we're looking at primary prevention through to secondary and tertiary. So the languages are similar when we're talking about stopping things before they happen, and it really does help if organisations become cognizant with the concepts of gender. Maybe a feminist lens as well wouldn't go astray, but we certainly, I'm well and truly connected to, and really enjoy the time that I've spent with the GAD pod and training with Rachael particularly. So once again, thanks, great job, Rach, and we'll finish up here because our time has run out. Thank you very much.
That's fantastic. Thank you so much, Steve and Rachael. You did an extraordinary job in wrapping up 10 years of extraordinary work by Gender and Disaster Australia. And you had to speak very quickly in order to do it. So thank you so much. I'd really encourage everybody to check out the Gender and Disaster Australia website, or Gender and Disaster Pod. If you just Google that, you'll find it. There's an enormous range of research, information and resources. You can order the postcards through the website, and I know that Steve and Rachael would certainly welcome anybody making contact with them to discuss any needs that you may have. And just a quick reflection from me on some of what both Steve and Rachael said, and it also brings in the work of Beyond Bushfires, which is really that those very early experiences around emergencies and what happens during response and what happens during relief can have lifelong implications and lifelong repercussions. And if you have a gendered nature within those responses and within that relief framework, and those repercussions can last a lifetime and can be intergenerational as well, as they can definitely impact on children and the broader families and even broader communities. So look, thank you so much, Steve and Rachael, for your time. We really appreciate it. We look forward to working with you again in the future, and hope you enjoy the rest of today's presentations. Thanks.
Thanks, Bridget. Will do.
Fantastic. Thank you for that. And as I said, do jump onto the website. I'm really pleased now to introduce our second speaker, Jen Hargrave. So Jen is a Senior Policy Officer at Women with Disabilities Victoria. Jen is also a research assistant at the University of Melbourne, supporting the School of Population Health's investigation into the prevalence of violence, abuse and neglect experienced by Australians with disabilities. So what we've known for some time, and what really came into stark relief during the pandemic, is how little people with disabilities have been considered in the contexts of emergencies and disasters. And I think if you add gender into this mix, you can really see some really serious impacts of this lack of consideration. Jen's going to tell us more about women with disabilities and disasters. Welcome, Jen.
Thanks, Bridget. I might start by acknowledging the traditional owners of the land. I'm coming to you from the lands of the Wurundjeri people, and I grew up in the Strathbogie area on the lands of the Dungarung people. I can't actually see if my slides are up. Are they? There they are. So as Bridget said, I'm from Women with Disabilities Victoria. We're what's called a disabled persons organisation, which means we're run by people with disabilities in our staff and in our board. We do community building, workforce capacity building, and systemic advocacy. Community building we find so important because of the high levels of isolation, loneliness and discrimination that women with disabilities experience. And systemic advocacy is the main area I focus on around trying to address ableism and sexism in our policies. And my work has focused on violence against women. So disability in Australia, 20% of Australians have a disability. And often if we think about disability, we just think of the NDIS, but we need to know that actually only 1 in 10 Australians with a disability receives the NDIS. And of those who do, 50% of eligible people should be women, but in fact, only about 37% of participants are women. So when we think of disability, we need to think much more broadly than the NDIS because that's just a small bit of the picture. Disability is diverse. It can be lifelong or it can be acquired. It can be permanent, temporary, or fluctuating. It can be visible or it can be invisible. So you might not know if someone you're going past has a disability. Disaster discussions often take a medical view of disability and focus on our impairments. Our disaster work must also be informed by the social model of disability. That is, that we're disabled by our society and our structures, those that design our physical environment, and our communications and our social norms. If we think about disasters and pandemics in Australia, and online you can find great maps of and timelines of all the disasters we've had. If we think of events right through from Cyclone Tracy to Black Saturday, and what comes to mind, we really don't tend to get many ideas around disability coming to mind. What we saw through news reports and so on didn't tend to reflect the experiences of people with disabilities. And the same has been so in the most recent pandemic that we had before this one around H1N1. And with this current one of coronavirus, we count vaccination rates and cases and deaths, but there's very little reporting around people with disabilities amongst all of that. Disabled women in disasters. So in published literature and resources, we find some good work about women in disasters. And I'm so honoured to be on with this lineup who have done terrific work, the presenters today, around women in disasters. We also find a little bit about people with disabilities in disasters, and most of that work comes from overseas, and there's a lot we can learn internationally around people with disabilities in disasters. But we find hardly anything about women with disabilities in disasters. WDV in this presentation is informed by our COVID-19 consultations with our experts by experience groups that we run, and also the large amounts of research that we do into disabled women, safety and equity, and also our own personal lived experiences as disabled women. So we'd like to share some inequalities in disaster, which we think are relevant to planning, crisis and recovery. And along through the presentation, I'll make some recommendations. One of the first areas for us to think about is communication. So some disabled women say they found the COVID-19 information confusing, and I've had a couple of women with intellectual disabilities blame themselves for being confused and say they think it's because of their disability that they can't understand the information being given. And, I think a lot of us have found the information confusing. So I think that's an interesting lesson around how women can blame themselves around finding information confusing, but also it tells us we need to be making information more accessible. Others haven't been able to access information about the virus at all. Some things that have been working well around information access and communication through the pandemic is providing Auslan interpreters both at medical appointments but also in media conferences. Providing information in pictures or in videos where it's really accessible and works across languages and literacy levels and so on. Also following guidelines to make documents accessible for blind people. So a lot of blind people will use screen reading software, in which case picture files where text is in pictures is not accessible. And even some of the Premier's press releases around COVID-19 have been picture files, and so not accessible to people who use screen readers. Also encouraging frontline workers to be flexible communicators. So for example, if someone's reading a vaccination consent form or giving instructions around evacuation, how familiar are they with working with a diversity of individuals and able to alter their communication style? And lastly, giving information to people where and when they need it. Not everyone has the internet. So a little bit more about the internet. There's you might have seen people with disabilities on social media celebrating how much of the world's been made more accessible during the pandemic, because they don't have to use inaccessible transport systems and so on. They can work from home on their computers, and the impacts of their disability have been reduced through that. But we have to acknowledge that not all women with disabilities have access to the internet. There's a very real digital divide here. So many women with disabilities do not have access to the internet due to factors like financial pressures, low literacy, and little to no technology experience. Others don't have independent access to the internet due to issues like dexterity, so being able to manage the buttons on phones and tablets and computers, literacy, hearing and speech, and so on. So this digital divide impacts our safety in terms of whether we can get phone notifications about emergencies personally, or whether we can go to a telehealth appointment online without our partner hearing if we're experiencing family violence. It raises a number of equity issues, the internet situation. So when we run disaster planning and recovery consultations and activities, are we including the cohort of people with disabilities who don't have access to the internet? The next area to think about is resources and supports. So in the pandemic, disabled women have had inequitable access to the vaccines, to medicine, to disability equipment, to protective equipment, to food, and so on. In fact, a lot of our members have had real stress around how to get just day-to-day essential supplies during the pandemic. Peer support and formal supports break down around disasters. So this has serious impacts on our daily living with disabilities. Support workers no longer come to homes to help with eating or personal care or parenting supports. We have to remember that women with disabilities aren't just recipients of care, but we're also providers of care. Travelling to services decreases and ceases. So things like employment services and respite and daycare services break down. During the pandemic, disability services have been also places of high infection risk. So disability group homes, for example, we've seen a number of COVID outbreaks in those services. There's also a reduction in peer supports, and peer supports are so important because that's where we share information and strength with each other. Unfortunately, this situation in disasters exacerbates already high baseline levels of social exclusion. And so I think we need to think about what we can do around proactive action to do community building that's inclusive of people with disabilities. So when disaster strikes, it doesn't have such a great impact. The next area to think about is psychological impacts. So there's a stark reality to disaster plans which leave disabled people last. Even in WDV's own fire plan, our fire plan for our office at work, those who can't run down the stairs are told to wait for the fire brigade while others evacuate independently. Much public pandemic discussion is on who should be first in line for life-saving resources like ventilators. Disabled women themselves have identified a psychological impact to hearing we're the last priority. As a coping strategy, women say they have reduced their media intake to try and shut out those negative messages around being a last priority. As a norm, disabled women are often perceived as burdens, and this additional disaster discourse around us being burdens and low priorities further reduces personal senses of belonging and value. And that burden archetype is also a reinforcing factor in the really high rates of gender-based violence that we experience. So I think when we're talking about who's first in line to get help in disasters, it really requires some sensitivity about thinking about who out there is hearing what you're saying around who gets priority. All of this, of course, the experiences of women with disabilities that I'm talking about here is on top of the psychological experiences of all women in disasters, including increased caring responsibilities, economic stress, changed relationships with paid work, isolation, loss of therapeutic supports, and increased risk of violence. The next area for us to think about is physical barriers. So the bushfire story of the man saying he wants to stay and defend while his partner wants to evacuate is so familiar to many of us. And the Gender and Disaster Australia group have written about this phenomena so well and done such important work to help raise awareness around that issue. But this scenario is heavy for disabled women due to the physical access barriers we experience. Many of us cannot drive or access public transport. Electric wheelchairs may not function in rain or floods or snow or extreme temperatures. In the heat, some health conditions and medicines reduce capacity to problem solve and to move, to actually have mobility. Actions like climbing and running may not be an option for many of us. And some people with a vision impairment in crisis scenarios can find the directions given meaningless. I've got a vision impairment, and I find some of the signs that go up around disasters, I just can't see them or notice them. And a lot of people might yell something like, "Quick, go over there and point." And as someone with a vision impairment, I become stressed. I know they're stressed, but I can't understand where they're pointing and what they're trying to get me to do. So it doesn't help. Many of us do not identify with being vulnerable. So, you know, the way people with disabilities are often described around disasters is as being vulnerable. There's really very few women I know who would want to go and register themselves as vulnerable. Certainly carers may want to nominate people they care for as vulnerable, but it's not an experience many people would want to identify with themselves or go and be registered with by some third party. And they might have questions around the privacy of that list, whether that list would be updated, and how useful that list would actually be in a crisis. So I don't have any easy answers to that question, but I'd like to be involved in discussions and for us to be thinking a bit more broadly about new approaches and alternatives to vulnerability registers. And the last area I wanted to speak about is about policies and guidelines. So it took extensive advocacy from disabled persons organisations and academics to see disabled people even included in pandemic policy. And this resulted in a COVID-19 Australian Management and Operational Plan for people with disabilities. The Disability Royal Commission that's running at the moment also dedicated hearings to pandemic and disaster responses. But in reality, this has had very little impact on the ground. And, you know, we're still experiencing high rates of under-vaccination despite being a priority group. So advocacy continues. Hopefully we can do better around including people with disabilities in pandemic recovery and planning for future disasters. We can be funding disabled women to take part in the development of policies and guidelines. And, you know, there's resources around how to make that accessible, how to make that work accessible. We can also be looking at reasonable adjustments to information sharing, information access, employment, healthcare, and so on. So we know that what I think going forward, it would be good to keep in mind is to know that disabled women are impacted by both disability and by gender. So governments and services need to consider our safety from gender-based violence, our health and our sexual and reproductive health around disasters. We should all be thinking about making information and consultations accessible for disabled people, and remember that not everyone has safe, independent access to the internet. We should be thinking about representing disabled women in research and data and guidelines, and to know that governments can fund disabled persons' organisations to inform this work. but ultimately everyday actions that we do to inform ourselves about gender sensitive disability access strategies and to increase social inclusion of disabled people will fundamentally improve the planning, responses and recovery for disabled women in disasters. And that is it from me. Thank you so much.
Gosh, thank you so much, Jen. And like Steve and Rachel, an enormous presentation with actually so much in there, such richness of experience and insight, and we really appreciate you sharing it with us. One of the things that I really wanted to highlight to everybody attending today is really just how disregarded people with a disability were, particularly during COVID-19. From the outset of the pandemic, the focus was very much on older people, aged people, and also very young people as being particularly vulnerable to the pandemic. And it took an awful lot of advocacy from the disability sector, from disability organisations like Women with Disabilities Victoria, to really highlight the fact that people with a disability, because of their disability or because of other either physical conditions or the situations in which they're living, were in fact highly susceptible to really detrimental impacts from the virus. And it took a lot of work to get governments and the emergency management kind of system to really respond adequately to that, and to ensure that things like disability support workers and in fact the whole system that sits around people with a disability aiming to support them were supported themselves. So they're very much a sort of a forgotten sector, I think, in terms of emergencies and disasters. Jen, thank you so much for your presentation again. I know that there would potentially be lots of questions for you, but we have run out of time. I'm so sorry. I hope you stay and enjoy the rest of the presentations, and I certainly look forward to touching base with you personally very soon. Thanks, Jen.
Thanks so much, Bridget. Thank you.
Thanks. Thank you, everybody. What an amazing presentation. I'm really pleased now to introduce our third speaker, Dr. Regina Torres-Quiazon. Regina is the Research, Advocacy and Policy Manager at the Multicultural Centre for Women's Health. Regina has a significant experience across government, community and the tertiary education sectors in working with women from multicultural backgrounds. And like women with disabilities, members of multicultural communities can face real barriers when it comes to emergencies. A lack of information and language, lack of cultural safety, and importantly, I think, the lack of understanding about what strengths multicultural communities have and can be built on really contributes to this. So Regina's going to talk to us about multicultural women in the context of emergencies. Welcome, Regina. There she is.
So I'd also
welcome.
Hi there. I'd also like to acknowledge the traditional custodians on the land on which I'm speaking on today, the Wurundjeri people, and I'm also proud to acknowledge that the land on which I've migrated, work and live was and always will be Aboriginal land. So thank you. So next slide, please. So I guess, yeah, I am from the Multicultural Centre for Women's Health, and I wanted to spend a little bit of time talking about what MCWH does. And I guess it's not really a simple plug for what we do, because I really wanted to give you a better understanding of how we've come to develop and implement the project that I'll be talking about today, which is the Workforce of Multilingual Health Educators project, otherwise known as WOMEN. Because MCWH has been going for about 43 years now. So there's a lot of knowledge and expertise there, and a lot of work and thinking has gone into the current project that we're delivering in response to COVID-19. So what we do is really, there's 4 prongs to what we do. We currently have a bilingual health education team of about 26 educators speaking over 35 different languages. We also have a very large, I've been told, the largest multilingual women's health information library in the Southern Hemisphere. And we also conduct training to community and health practitioners who really want to improve health outcomes for migrant and refugee women. And we work with universities as well on research and use that research for our advocacy and policy consultations. But I think what's really important to know about MCWH is the 4 key pillars of our approach, because it's really critical to the work that we do, and it's what has worked really well in the last 40 years or so. We use an intersectional approach, and I can't stress that clearly enough. And I mean, intersectionality is often used incorrectly as a stand-in for diversity, but really it is about looking at the power dynamics in any situation and working towards social justice outcomes. So at MCWH, for example, we look more closely at the discriminatory impacts of migration policies. And as Steve had raised in his presentation as well, really looking at the legacies of colonisation and how that might impact on migrant and refugee communities. And Jen, in her presentation, had brought up the issue of vulnerability, and usually, migrant women too are also seen as vulnerable. But, migrant and refugee women are really made vulnerable, by the systems and structures and policies around us. And that really is what an intersectional approach is about. The fact also that we're women-led is very important. All staff are from migrant and refugee communities. So for us, that representation is really key to the work that we do. So it really, we walk the talk in terms of the values around, nothing about us, without us. And the evidence base, again, we have heard this quite a bit about needing the evidence base in order to develop really good, effective policy. But this also includes really looking at the gaps in our knowledge and the evidence base, particularly as it refers to migrant and refugee communities, and women especially, because the data and the evidence base is lacking. We do work with a lot of ethno-specific and multicultural groups, but we also work with a variety of stakeholders working on a variety of issues, including sexual and reproductive health and also prevention of violence against women. Next slide, please. So I guess, as we know, it's become very clear now in terms of the evidence base that really the virus impact is highly gendered. And we know that before the pandemic, Australia was already going backwards on the World Economic Forum's Global Gender Gap Index, for example. We were 44th in the world, and really that was coming down. We were at a high on 15th about 20 years ago. And there is a high risk, if it hasn't happened already, that, gender inequity will be worsened by this virus. So already we know, and, Rachael and Steve and Jen have already touched on some of these issues, that family violence increases during the aftermath of all disasters. Women are also at a greater risk of exposure to the illness, especially if you're working in lower paid jobs. And we know that the essential workforce is essentially made up of women, and especially more women are working in the health, social assistance, age, disability and mental health care, education, teaching, cleaning, retail services as well. And we've also seen that more women are unemployed as a consequence of the virus. Our labour force statistics show that 55% of people unemployed were because of the lockdowns and what's happening in the current situation. And for those who are still in paid work, we know that 11.5% of women have reduced their hours. This is compared to 7.5% of men. Women are also shouldering a bigger burden of unpaid labour in the home. And, you know, this work isn't being divided equitably, especially now that we know that, you know, childcare is also being closed down for good reason, but a lot of women are shouldering that burden. And it's also really important to point out that specialist women's health services are also being adversely affected by the pandemic. So, you know, resources and priorities are being shifted away from essential services such as sexual and reproductive health. And we're seeing that especially with women who are unable to access timely abortions, for example, especially women from migrant backgrounds who are on temporary visas, especially who don't have access to Medicare. That's becoming a real issue. So we can see in lots of different ways that even though we know that the virus impact is highly gendered, that, you know, it impacts women in complex and diverse ways. Next slide, please. So the impact, this is what we know, and this is what's coming through our research and advocacy and delivery of our programs, that the impact on women from migrant communities it is quite acute. We know that they're more susceptible to health impacts, both at the individual and systemic levels. And primarily, especially, we can see a good example of that is the international student population and others who are on temporary visas who don't have access to Commonwealth benefits or have access to healthcare or are not covered by Medicare as well. So we know that also, you know, they're overrepresented in the so-called hotspot areas. What we've learned through what's happened in public housing and migrant workers who are working in essential services, who need to continue to work, I mean, these factors have increased their risk. And I know Jen's also touched on this around issues around the digital divide. It is certainly real. And this is the key issue, that a lot of migrant and refugee communities really don't have the same level or quality of access to COVID-19 information. And there is a huge gap in distribution of that information. And I also just mentioned, especially for migrant and refugee communities, the evidence is becoming clearer that it has impacted migrant women especially, and has increased their risk to domestic violence and other forms of violence. Next slide, please. So I thought I'd put this very strong quote in from Zili Malumbo Nguka from the latest Commission of the Status of Women. And we know by this quote that the reference to men really is essentially a reference to power structures that marginalise and discriminate and result in inequities for particular groups of women especially. So Rachael had raised the fact about disentangling masculinity, and this is really the case here. How can we do that? I think we need to place women who have been marginalised at the centre and at the focus of our programming and actions, because it's usually community leaders are often male. So it's really important to recognise women's leadership in our efforts. At MCWH specifically, in terms of the health education that we deliver, we have found that it's women who are more likely to pass on health information to family and community. And in many communities, we know that women really are at the forefront of health and household responsibility, and they're really in the best position to bring about that behaviour change. And also to advocate for whatever needs their communities might need. Next slide, please. So in thinking about this project, this was at the core of our project. Really, if we are to have an equitable and inclusive response and recovery, we need to make sure that migrant women really have the best opportunities to experience the same health and wellbeing outcomes as other Victorians. And I guess for all the reasons that I previously outlined. Next slide, please. And this is how this thinking has resulted in the Woman Project. It's funded by the Department of Jobs, Precinct and Regions via the Working for Victoria program. It is a significant investment of $1.5 million, but it is only over 6 months. Essentially, this model expands the 40 years of work that the centre has been conducted in relation to the delivery of a health education program. And it really is to build health promotion and education capacity to try and effectively meet the needs of COVID-19, as well as women's health information needs of migrant and refugee women. We're implementing this project as part of a consortium of other regional and statewide women's health services and Gender Equity Victoria. So there's a group of 11, and in terms of a women's health infrastructure, it was already there, but we really wanted to get together and provide that strength in terms of building a sustainable infrastructure that would have the best possible chance, I guess, of continuing after the 6 months. And what's really important about this project as well, and we're at an exciting point in time, is we're collecting through interviews, in-depth interviews, migrant refugee women's experiences of COVID-19. So to make sure that we fully understand what those challenges are for women and include them in our recovery initiatives. Next slide, please. And this is just a brief outline of how we've conducted the project. We're really up to the point of documenting the stories now, and we're hoping that the final report will be launched by the end of September. The data, I mean, we're looking at issues like the impact of health-seeking needs for migrant women during this time. Also COVID-19 information needs, the impact on unpaid care work and labour and employment as well. But we've also asked migrant refugee women what they'd like to see coming through in the recovery phase and what might be important for them and their communities. Next slide, please. So just a few key, I guess, milestones for the Women Project so far, and I haven't updated the infographic here because I haven't been tech savvy enough to do that. But as of last week, we've conducted nearly 70 sessions with migrant groups and with a total of close to 1,000 women. So really there is so much to do, and I guess I'm feeling frustrated that the project is due to end in November But as you can see, in such a short period of time, we've been able to train 50 women to deliver health education sessions to women in their community, and to reach about 1,000 women from various different migrant groups, I think is just amazing. So I'm still hoping for an 11th hour, perhaps funding injection, that this infrastructure will continue into the new year. Next slide, please. And just to finish off, I guess, want to reiterate and reinforce what Rachael and Steve and Jen have said so far about really ensuring gender equal response and recovery. And these are the things, I guess, the key ingredients for us in terms of ensuring that happens, and that includes women from migrant backgrounds, that we apply anything that we do in terms of programming, that we apply an intersectional lens. Again, not about diversity or ticking the box in terms of identity characteristics, but really having a look at where the power dynamics are. Ensuring that, you know, the messaging that we have really targets women, especially those that have been most marginalised by the power structures and our policies. We need to also support gender equal decision making, and really the way we can do that is to really listen to and amplify the voices of women. And we need to form equitable partnerships. So to really, if we can, prioritise migrant women's leaderships in the initiatives we put together and our recovery. So one way you can do this is really to collaborate with migrant women's organisations for that expert advice. And I can't stress highly enough the gaps in our evidence base in relation to what works well specifically for migrant communities, because we're still not, you know, collecting data on country of birth, cultural background. Visa status is very important, again, because it helps us know who's missing out on access to particular services. And really, in terms of the Women Project, the infrastructure is there, and it's really important that we continue to support statewide infrastructures that really delivers the type of community-led responses that will be meaningful for the communities that we're working with. And that's it, but I will, at the next slide, please, these are just a few quotes. I think I'll end my presentation with quotes from a couple of our health educators who have come through the program. They both, Iman and Aisha, have been fantastic educators, but also wonderful advocates in terms of highlighting what the particular issues are for migrant women, and really highlighting the need for this sort of information mechanism for migrant communities. So it's peer-led, it's led by women from migrant communities, and they have become excellent ambassadors in terms of their own communities, but also for women in general as well. And the final slide, yeah, just a few photographs here of some of the health educators, so who really would like to continue the work in this area. So thank you. I'm hoping, yeah, some of you will get in touch, because there are a lot more reports and research in terms of some of the things that I've spoken about today. Okay, thank you for your time.
Thank you so much, Regina. What amazing work your organisation does for and with women from multicultural backgrounds. Just so impressive. And look, those of you who know me know that I often talk about the importance of the emergency management sector working much more closely with the community sector. Because that can really help inform and enable better outcomes for all of our communities before, during and after emergency events. And working with an organisation like Regina's, of course, can only help us better, reflect and work with and work in our extraordinarily diverse community that we have here in Victoria. And I think that you can all agree that, organisations like Women with Disabilities Victoria, as well as the Multicultural Centre for Women's Health, have got such strong skills and insights and connections, and they're just so well placed to play an active role in and around emergency management and disaster resilience. So here's hoping that funding comes through for you, Regina. Hopefully somebody's listening out there and can tick a box for you. Thank you so much, Regina.
Thank you.
I'm really pleased now to introduce to you our last speaker. Our last speaker is Jenny Beales. She is a community member and an advocate at Women's Health Grampians. I think it's really exciting that we've got Jenny here to tell us her story today. Jenny has lived experience of a very serious and major disaster event, but she's also a proud and passionate advocate for women and also older women. We're really excited to sort of round out today's session where we've heard from researchers and community organisations with such deep and rich insights. And I always think it's just so important to hear from real people on the ground about their own stories. Welcome, Jenny.
Bridget. So today I am living in Ararat, and I'm on Jabberong, the land of the Jabberong people, and I pay my respects to their elders, past, present and emerging. So for 30 years, my family and I lived in Kinglake and went through the Black Saturday fires. So on the 7th of February, my husband Peter and our adult daughter Jessica were at home. Peter was working as a disability support worker at the time, working night shift, and was trying to sleep when the weather was 47 degrees. So there wasn't much sleep. Our adult son Adrian was living in Melbourne and had rung to say he was going to come and visit, and I told him, don't bother. Luckily for once, he paid attention to his mother. I was monitoring the ABC radio all day and preparing for a possible fire. All day, John Fain was on ABC radio giving updates about the news that there was a fire at Kilmore, which was about 60 kilometres from Kinglake. At about 4:30, I received a call from a friend of mine in Pine Ridge Road, Kinglake West, and she said that she could see smoke up in her upper windows and was leaving to head down to Lilydale, within a few minutes, and she'd packed and left. So by this stage, we knew that the fire was no longer at Kilmore. And it meant that the fire was much closer. So I woke Peter, and within about a few minutes, we had about 8 cars streamed down our dirt road, and we're about 3 kilometres north of the town. In 2006 fires, we'd had fires in Kinglake, but not too bad. We'd formed what was called a fireguard group, and our neighbouring, the houses, the neighbours 2 down from us, they arrived on Black Saturday along with lots of other people, some of whom you knew, and a lot of them were actually total strangers. At about 5 o'clock, and you can see the next slide, the fire hit Kinglake, and it was like standing on Tullamarine Airport. The sound was so intense. If you move on to the next slide. Thank you. So in all, we had 26 people sheltering in our house that night. Some were total strangers, older people, children, cats, dogs and a rabbit. One woman had left her husband behind in Ninks Road, Strathewen, and she and the daughter drove up through the fire to Kinglake, down our dirt road. She had no idea where she was, but she ended up sheltering in our home, and her husband and son ultimately survived by jumping in their dam. So the next slide. As you can see, a couple of the older people who sheltered in our home, and neither of them we knew at the time, but thankfully they were safe. And next slide, please. So the next morning we managed to drive up from our home 3 kilometres north of town up into the main township, and this was what greeted us. The petrol station had blown up during the night. Next slide. This was the many cars that had crashed on the main road. Next slide. And that was the St Andrews Road, or the view of the St Andrews Road from Kinglake. So those slides show something of the aftermath and the impact on the township. So next slide. Ultimately, in the beginning we had community meetings on open land near the Murrindindi Shire office. So Murrindindi Shire stretches from Eildon, Alexandra, Yea, Marysville down to Kinglake. And luckily the Shire office hadn't burnt down, and so we were able to run all the resources from that centre, and the police station was scorched but not burnt down, and the hotel survived, and as did the old CFA shed. The community meetings were vital to give people information, and people needed to hear what was happening and could come to the Kinglake Centre each day, twice a day in fact, for meetings to hear what was happening. Initially, as I said, it was meetings just in the open air, but very quickly we organised a very large tent, like a tent, and so people were able to shelter in some shade to get, the vital information. And from the very beginning, it was women, particularly older women, who took a real lead in what was happening in Kinglake. Particularly, as I said, older women, because they often didn't have to worry about small children, and so they could take a leading role. And many of them had lost their own homes, but were still able to coordinate what was happening in the community. So next slide, please. This is a photo of some of the Kinglake CFA crew from Kinglake itself. And as you can see, there were quite a number of women who fought the fires themselves. And many of those women and the men lost their own homes trying to defend the town. Next slide. Again, these were some of the amazing Kinglake Fire Brigade women, and a number of them sheltered in the fire shed, which was just an old tin shed, and treated people. Quite a few of them had nursing skills and were able to treat people who were badly burnt, and then they were evacuated in the early hours of the morning down into Melbourne through the fires. Next slide, please. So one of the first issues pretty quickly emerged of potable water, because Kinglake, the whole of the community, only had tank water, and most tanks had burnt down or were very badly polluted by the ash from the fires. And so we needed to get clean water to people pretty quickly. We survived on sausages for a long time. Sausages and bread was the staple diet for Kinglake, and it was a very third world environment. It certainly made you understand what it was like for people in poorer countries who go through a major disaster. In the immediate aftermath, it was older women and men, but who took roles in recovery. In this photo, Gail on the left, who'd been the neighbourhood house coordinator, she opened up, there was a large empty shop in the main street that hadn't burnt down, and they opened that up as a place where people could get food, clothing, blankets, and all the sorts of bits and pieces you needed if your house had burnt down. At one stage, we had lots of donated goods that were very valuable, including G-strings and frilly underwear, and that was quite exciting and good for a bit of a laugh. Anne Leadbeater on the right was Murrindindi Shire's Community Services Officer and became one of the key people in coordinating the twice daily meetings with the various agencies who came to town. My husband in the red shirt was the local councillor for Kinglake. 6 months later became the mayor. He stayed in the Shire office for the first 48 hours, taking lots of calls from people from other countries in the world who were concerned about their families. So in 2011, Women's Health Goulburn North East, who we've already heard from today, prepared a report called The Way He Tells It, Relationships After Black Saturday. And it looks at the issues that are faced by women following the February 2009 fires. Oops, I've lost a page. Sorry, folks. I don't do this very often, obviously. 2 comments from women stand out for me from this report. As the wife in the situation or the mother, you do not have the luxury of saying, oh, fuck it, I'm sick of this. Someone else do it, because the buck stops with you. And women get together and cry and hold each other. And then they go, righto, girls, back in the game. There you go. You had your little sulk. We love you. We understand. We've all been through it too. Go and make the dinner. So what was the long-term impact for women? Many women were home alone on the day of the fires with their children, particularly if the men were fighting the fires. Some women had the responsibility of assisting elderly neighbours. A family of 4 who I knew quite well died trying to save an elderly disabled neighbour. They were among 25 people I knew who died. In the fire's aftermath, there was certainly an increase in family violence and alcohol use. Women's Health Goulburn North East mentioned that for many women, family violence was a new problem, though for others, existing family violence issues escalated. Later, there were challenges for people who'd lost their homes living in the temporary village. There are about 200 cabins set up for families whilst they rebuilt. So people were living cheek by jowl, and living in those circumstances for a couple of years put pressure on families and led also to an increase in family violence. Initially, the basic needs of safety, shelter, water and food were prioritised, and family violence issues were pretty much down the list. In a way, men and women had been through so much it was easy to excuse the pressure people felt and some bad behaviour, and that often led to violence. All of us suffered from what we call survivor guilt, and many people, particularly men, felt guilty they hadn't been able to save their own homes. Our neighbour, who lived in dense bush, commented to me only today that whilst their plan was to set off the sprinkler system and come to our house, as per our fire guard plan, she actually had to drag her husband to our place because he wanted to stay and defend his castle. Many men stayed to defend the family home, not realising that a home can be rebuilt, but lives can't. As the Women's Health Goulburn North East report states, the most significant social determinant of violence against women is the unequal distribution of power and resources between men and women and adherence to rigidly defined social roles. I think this was a very true statement for many families in the Kinglake Ranges. In terms of recovery, I think it's also very important that women should be included at all levels of disaster planning, response and recovery, as I believe women bring a different insight to disasters and what is needed in the aftermath. And we've heard that from all the other speakers today. A couple of examples I wanted to actually mention some of the bureaucratic challenges faced by the community after the 2009 fires. In response to parents who wanted to bring their children together the day after the fires, a female teacher from Kinglake Primary School opened up the school, allowing the parents to talk and the children to play, supervised on the play equipment. And Kinglake Primary School had not burnt down, so it was quite safe. The teacher was contacted the next day by the Department of Education and ordered to go to Whittlesea, even though that meant driving back down through, bushfire, burning bush. And she was told she should not have opened the school, as she was not authorised to do so, as the department had not yet done a safety check on the building. In fact, quite a few people had broken into the school on the night of the fires and sought shelter there, including a young woman with a 3-week-old baby. The teacher's support of parents and children was, I believe, exemplary, and she should not have been criticised for using her own sound judgment. 2 years after the fires, the Kinglake community formed a new Rotary Club, and Rotary International built a youth centre in Kinglake. And the Rotary Club funded mental health first aid courses, as there had been a number of suicides in the community, and Peter and I were charter members of that club. As well, one of the issues raised with our club by the school nurse from Whittlesea was that children were bedwetting. Not little children, not toddlers, but 10 and 12-year-olds who'd been so traumatised by the experience of the last year or so that they had reverted to bedwetting. The Department of Education would not fund bedwetting alarms, which would allow the child to manage their own bedwetting, so Rotary funded them. So these are just two examples of where often community organisations, particularly those with local membership, have a much better idea of what will work in a particular community, and hence the great importance of community driving its own recovery. So those are my comments on what happened in my community all those years ago, and thank you very much for including me in your presentation.
Thank you so much, Jenny, for sharing your story. We really appreciate it. It's wonderful of you to be able to share that. Did you want to tell us a little bit about the art that you've got in the background where you're sitting?
Yes, I'm a bit into patchwork these days as I've retired and got a bit of time on my hands. And I did a fabulous course in the Grampians. They run something called Grampians Texture, and then for a weekend in March, and Grampians Arts is held later in the year. I went to the Grampians Texture weekend 2 years ago. Most people were doing small pictures of villages with fabric and bits and pieces. It was very, really therapeutic. But I decided to do a bushfire, the St Andrews Road on fire. And so over the last couple of years, I've finished it. So it's the fire coming up the St Andrews Road, the devastation afterwards, and then the regrowth, what's called the epicomic growth, where the gum trees just suddenly sprout beautiful bright green leaves up and down their trunks. And it reminds you that, yes, we can all regrow from what was a terrible disaster.
Absolutely. Thank you so much. Very talented and amazing artwork. Jenny, if there was a piece of advice that you would give to any woman, young or old, that might be thinking about moving to a country area, living in a country area, preparing for bushfire, facing a bushfire or recovering from a bushfire, what would that be?
Very much get involved in local community organisations. Country communities survive on people being involved because there isn't always the infrastructure to have all the professionals there to do everything for you. And get to know your neighbours well and do your planning. If you live in an area that's subject to fire overlays, make sure you know that to plan and don't stay. If you've got young children, leave. Go and stay somewhere safer. Go to the town hall or somewhere. There'll be a designated area that is safe for families. And I think people were so traumatised. You can hear it in my voice in a way, I suspect. I'm still traumatised by it to this day. And I think it's so important that your mental well-being is far more important than your home. Homes can be rebuilt, lives can't.
Absolutely. Very wise words and born of experience. Jenny, thank you so much. We have run out of time today for our gender and disaster recovery conversation. I want to extend a huge thank you to Steve and Rachael, to Jen, to Regina, and finally to Jenny for all making the time today to share in their expertise, their experiences and their insights. A great big thank you, of course, to our Auslan interpreters for help making this event accessible. And thank you again to Lord Mayor's Charitable Foundation for their generous funding. And finally, thank you all for attending. We look forward to seeing you at the next disaster recovery conversation, where we'll be discussing community-led disaster recovery. Look forward to seeing you then. Thank you and good night.
During a crisis, humanitarians aim to deliver rapid and impartial assistance to save lives and meet essential needs. In our rush, we often assume that assistance and services are equitably accessible to everyone. But are all people affected by crisis in the same way? Of course not. Many factors shape our social roles, power and status, including gender, age, ethnicity, sexuality and disability. In crises, the traditional roles of girls, boys, women and men are disrupted. Existing gender inequalities may worsen and new inequalities arise. A crisis often disrupts men's ability to fulfill their gender role as breadwinner. Women and girls' ability to carry out their expected domestic and caregiving role may become more challenging as resources and services are scarce. When men and women are unable to fulfill their expected roles, stress and gender-based violence within the household may be more prevalent. Attempts to prevent sexual violence and protect family honour often mean girls' and women's mobility is restricted. Child marriage among girls may increase, especially when family resources are stretched. Gendered expectations of men and boys as family and community protectors can increase their risk of being drawn into dangerous activities. Men's higher social status and educational level can influence their access to and control over resources and services.
So what must we do? Firstly, don't make assumptions. Conduct a gender analysis to understand the different and specific needs, capacities and vulnerabilities of girls and women, boys and men of different ages and social groups. For example, girls' education may be limited by gender norms, a lack of female teachers, shared toilets and insecurity on the journey to school, whereas boys may drop out to earn an income to support their family. Without analysis, we risk reinforcing power imbalances and restricting equitable benefit from assistance, therefore causing harm. Secondly, remember, one size does not fit all. Using information collected, adapt the design and delivery of assistance. Address the different barriers that girls and boys, women and men face to equitably access assistance. For example, you might alter timing, location, transport and communication methods to improve safety and accessibility of distributions. Thirdly, promote meaningful participation in the design and delivery of assistance. Take specific actions to recognize and support women and girls' capacity and voice. Support men and boys to address their specific needs and involve them in addressing issues such as malnutrition. Gender balance and diversity in your team is also essential. Finally, continuously check that you have identified and met the different needs by collecting and analyzing data broken down by sex and age, and ensuring consultations and evaluations are conducted by staff and volunteers of the same gender and age. Crises can deepen inequalities, but together we can ensure our assistance equitably meets the different needs and upholds the equal rights of girls, boys, women and men.